Veterinary Services presents What happens to my pet when they come in for surgery? Today in our clinic, we have a neuter. Wait, isn't that a polar bear? Haha, nope, that's Thor, a lovable 10-month-old Pyrenees puppy. Once his family drops him off, our clinic staff will begin his visit by weighing him. Once we have his weight, we will bring him to the back where we will make sure he is comfortable until we are ready to begin. These are our oxygen tanks. Before we start, a technician will open the valve, being sure that the pressure and volume are at the correct levels. We then uncover our clean anesthetic machine and bear hugger. We use the bear hugger to keep your pet warm during surgery, so turning it on before they arrive is a must. Using your pet's weight, a registered veterinary health technician will calculate the appropriate drug doses needed, which for Thor is a lot. This is where we keep our surgery packs. Based off of your pet's needs, we gather the correct pack, scalpel, and suture to use during surgery. Once we have prepared and gathered all the tools and supplies that we need, we can begin. But first, it is time for pre-anesthetic blood work. This will help your vet evaluate many different body systems. Their blood work will also give us a better idea of how anesthesia will affect your pet. This will also establish a baseline value for your pet's body system, which can be used in future reference. We then take your pet's normal heart rate, temperature, and capillary refill time before giving a pre-medication. What is capillary refill time? CRT is simply the amount of time it takes for the color to return to their skin. Normally, it should only take 2 seconds or less. We then give your pet a pre-medication. This will make them very sleepy. Once they are sleepy enough, we are ready to begin. This procedure is not always black and white, so we want to take every precaution to make sure that your pet is safe and comfortable. We start by placing an IV catheter, which will give us quick and easy access to the vein, and also allowing us the option of giving them IV fluids, which will maintain your pet's hydration and blood pressure during surgery. Next, we give an induction. This is the final drug before surgery, putting them in a deep sleep before hooking them up to the anesthetic machine. Now what is happening here? That tube is specially chosen for Thor's size and weight so that we will have a proper connection to the anesthetic machine. Once your pet is completely under, we check their heart rate and temperature to make sure everything is going smoothly. We also trim their nails, being very careful not to clip the quick. The quick contains a blood vessel and a nerve. Therefore, we have to be very careful not to clip it. Pet's eyes have a tendency of drying out during surgery, so we make sure they are lubed up very well before taking them in. This is the pulse ox. Once we are sure that the levels are correct, we are ready to begin. And it's time to tattoo. We carefully pull out the sterile tattoo needle and insert it into the pen. What do their tattoos mean, you might ask? Well, the first letter represents the year the animal was tattooed. The second letter, or letters, represent the clinic your pet was tattooed at. All the numbers after that are your identifying client number. Each clinic will have these specifically for each individual and kept in their records. This is our dynamic duo, the Doppler and the pulse ox. Listen carefully. You can hear Thor's heartbeat. Each of these tools have a special role to help us monitor your pet during surgery. Once we have shaved and sterilized Thor's surgery location, We move him into surgery, where we do one more clean to make sure everything is sterile. Now it's time for the veterinarian to shine. The vet has to do their best to be as completely sterile as they can possibly be. Therefore, they have to carefully open their sterile gown pack. The vet then scrubs up, puts on her gown, then carefully puts gloves on, being very sure that everything remains sterile. Now that all the preparation is complete, our team can start the surgery. The vet can begin knowing that a registered veterinary technician is monitoring your pet during the entire procedure. The isoflurane is adjusted to ensure your pet's comfort, and their heart rate, temperature, capillary refill time, and much more is thoroughly recorded every 5 minutes. And with an easy fade, his surgery is complete. Now that Thor is ready to recover, he is immediately given a pain medication, and once again monitored very closely while he waits. On behalf of all of us here at Stone Ridge Vet Services, we thank you very much for watching and hope you join us for our next video.